Today's episode of the StallSide podcast was brought to you by Rood and Riddle Veterinary Pharmacy.
How goes it today, Bart?
It's going great, Peter. How are you?
Great, thanks. We have a very interesting guest on the show today, Dr. Jenny Hagen, and she is faculty at the University of Leipzig in Germany, and she's also in private practice looking at locomotor issues, chiropractic, and general rehabilitation of horses.
Yeah, and she's got an interesting story. You know, a lot of people had some experience when they entered vet school, and Jenny is no exception. She entered school as a farrier and was able to take that knowledge with her and go through school and has really put the whole thing together. And we brought her all the way from Germany to have this conversation.
Yeah, I know, and it just goes to prove that cross-pollination is a great thing, right? So if you just have this one-track mind where you think, yes, I'm going to be a veterinarian, and you shut your eyes to all the other sort of ancillary specialties that are associated with veterinary medicine, especially when you come to horses, you miss out on a whole lot. And what I'm really interested in hearing about today is Jenny's approach to a horse. And I think it's going to be a little bit different than people that have a sort of a silo mentality in that, okay, the horse is lame, and so I'll just look at the foot. The horse has got an injured tendon, so I'll look at it with the ultrasound and see how things go, and then just try to actually look on the horse as a whole unit, and how do we get the best out of that.
Yeah, she pulls the whole thing together in a very interesting way, and it's going to be a great conversation.
Yeah. So on StallSide this week, we have Dr. Jenny Hagen. She's on faculty at the University of Leipzig in Germany, and she's going to talk all about her approach to the locomotor arrangement in the horse and how we can get the best out of them athletically. Dr. Hagen, welcome to StallSide.
Thank you. Thanks for inviting me.
Yeah, we're so glad to have you here. It was nice of you to stop in and be with us.
Okay, yeah, I'm really curious how it works, but I like the conference, and until now everybody's quite happy. Horses are ready, people are interested, so let's see what the demos bring.
Yeah. So Jenny, tell us a little bit about yourself, how you grew up, and who were the influences on your career?
Well, I grew up, of course, in Germany, but in the middle, so there's actually not a lot. And after school, I wanted to earn some money. And since I was already doing practical work with veterinarians, and you can't earn money with veterinarians, I asked the local farrier if he would just take me as an assistant. I actually wanted to get some little extra money before I start my study. And he was a very nice guy. And I asked him, hey, would you take me as an assistant? And he said, nothing. I was like, okay. So then I asked him again. I said, is it because I'm a girl? And he was like, no, okay, yeah, you can come one day. And then we did one day, and afterwards he asked, you can come tomorrow again. Okay. Then we drove 1 week together, and then he said, how long does it take until your study starts? And I said, yeah, 5 more months. Okay. So we were a team for 5 months, and he introduced me to all the farrier stuff, and I was allowed to trim and already to shape shoes, and I got a little bit the passion for this handcraft from him. And then I started the study, but I continued actually the whole years working with him in the semester breaks. So it was a parallel development of my veterinary career and shoeing or farrier career. And I really loved it. So when I finished my study, I was a little bit in other countries, but when I came back, there was the request at the university that there's a research project with farriers. And I said, okay, then it's probably mine. And that was the start of the very first big project where we examined 75 horses for 1 year with 3 different trimming methods. And yeah, that was actually the start of all the other projects developing, and also for my thesis and postdoc thesis.
Yeah, you have a very interesting approach to the horse, because you're not just looking at the hoof, you're not just looking at the tendons, you're looking at the whole horse. And you sort of take an approach that everything affects everything else and everything must be in balance. Can you tell us how you approach these cases where maybe there's a chronic lameness or there's a chronic imbalance in the hoof? How do you start looking at these horses, and how do you approach them to get them to the best possible horse they can be?
Well, I must say, one step back, that was a development. Mm-hmm. So as I said, I started as a classic vet, and I was a farrier, so I at least was able to connect feet somehow with pathologies. But in particular, during the last 5-6 years, I recognize that you have so much more in a horse responsible for performance and soundness that I started doing a lot of manual therapy courses like chiropractic, osteopathy, myofascial training, and all this rehab trainings you can do at least in Europe. And I recognized that we actually do too less to make a sustainable rehabilitation for horses. So we focus as vets on treating the tendon, and then we maybe recommend shoeing with the heel wedge, some box rest, a little bit hand walk, and then that's it, more or less. And I think we have so many more options to train horses already if they are in box rest. So even if they are just standing, you can activate muscles and proprioception. So you can make the tissue ready. You can control the proliferation and the remodeling phases of disorders by doing a good rehabilitation. So my aim and my goal is actually, with all the team I have in a stable, that we have the horse ready for the owner to go and to keep it sound, even if it's starting jumping or racing or whatever again. So that is actually our main aim.
Okay. So starting at the bottom and working up. So looking at the hoof, as you look at the hoof, how do you set that hoof up to have it in the best possible position for the horse?
So let's say one patient is coming with a third tendon injury here. So of course I check the hoof for trimming, but I must say I'm not addicted to one specific trimming method. So in Germany we have different ways of evaluating a hoof. I'm not so focused on, for example, flat-footed landing or something. I'm more that I would like to have in statics and during mid-stance leveled coronary bend, even load of the vaults, a very nice even surface, and then I would like to have strong heels. So actually nothing very special. Yeah, and then I'm usually shoeing tendons, and I think all the diseases I see, I ask myself, how can I relieve it? And the more severe the injury and the more acute, the more extreme my modifications can be. And the more the horse recovers and is starting to walk and going into dynamics, the more I have to adapt my shoeing. So what might work in statics can be very harmful in dynamics. So that's why I always try to adapt the shoeing depending on the status of rehabilitation and on the status of disease. Mm-hmm. So that's the first. So I really try to find the status of disease and affected structures. I shoe for the I do the best shoeing for this moment, being aware which options I have to modify further. And then depending if it's a very acute injury, of course, they are in box rest. But after, usually the most of the diseases start with 2 or 3 weeks going into the proliferation and healing phase. So we already start working with static engagement of the thorax and the muscles, with balance pads, with some exercises you can just do in the box. And after, like, depending also on the injury, but let's say 4 weeks to 5 weeks, we started, of course, walking, but not just walking. We would like to make it attractive to the horse, so we try to challenge it a little bit mentally. But we also try to walk it in a very specific posture that you activate the muscles you need in the 5 minutes, 10 minutes, 15 minutes hand walk, whatever you have to do. And then I have a good team who add more and more exercises in dynamics from this point until we are able to have a strong horse which can be ridden. And then again, we make the rehab program with a rider.
Mm-hmm. And you mentioned about you take a varied approach to how you set the hoof up. So in the acute phase of an injury, how would you set the hoof up? And as the horse healed the injury, as the tendons healed, how do you alter your shoeing approach to help that horse continue to heal?
Yeah, let's say with the example of a tendon injury, yeah, so if it's really acute, I really try to make a long like a long palmar extension or plantar extension. Palmar is always a bit tricky in the forelimbs, but as long as possible, and the horse can stay it. And then, of course, with heel wedges. So we did a lot of research how we can relieve tendons. So we know that we can relieve both tendons by elevating the heels, and of course with giving palmar support. And this is the very first shoeing. So the more acute and the more severe the damage, the longer and the higher I go with the shoes. And in the moment where it's in statics and box rest, it's usually quite good to control. In the moment where we start already a little bit with balance pads and doing something, I try to make the extension a little bit shorter. And in the moment it's going to the proliferation phase, I actually try to lower the heels already again. So my aim is actually, if we are going into the remodeling phase of the tendon, of the injury, where we also start walking more, I would like to have no heel elevation anymore, and I would like to have a palmar support, but fitting to the conformation and to the work of the horse.
Okay, and as that tendon heals, you talk about engaging the muscles in the thorax. How do you do that? What are the techniques?
Yeah, I was interested in that too, because you talked about exercises in the boxes you put it, but what are those?
Yeah. So I think it's very easy. I think everybody knows the exercise where you just give a little stimulus behind the sternum, and the horse is lifting a little bit the chest and also the shoulder. And most of people do it a little bit, let's say, wrong. Yeah, they do it too fast. So they make 1-2 scratches and the horse lifts 2 times and then they are happy. But this is not the approach we would like to see. We would like to make it very slow. So we give a stimulus, so maybe it lifts the chest or the back half a centimeter or a centimeter, and we wait until it can breathe, until it mobilizes. So a little bit like yoga. So if you go to the yoga lesson, usually your teacher gives you some stretching exercise, then it says, or he says, now you have to breathe. Yeah, so this is actually what we try with the horses, and it can be very exhausting, and we try to have it lifted for minutes, breathing, and we try to go as high as possible. And if it's able to do this exercise, we engage or we flex a little bit also the pelvis in the same way, very slow, that it's activating the hinds and even have more power, or need more force, more power in the whole upper body to hold it. And if it's able to do this, we start with core stability exercises on the balance pads, so we have the same posture. But we try to move the neck and the head down between the feet or to the side or whatever. So it can be exhausting. So if you have a horse doing it like for 10 to 20 minutes a day, you can achieve a lot.
Yeah, that's actually quite surprising, because the amount of time that you have to put into that, I think, would surprise a lot of people.
Yeah.
Because people talk about doing their carrot stretches, and so they'll just, the horse will just go down once or twice, they're giving the horse a treat, and then they think they're done. But you're saying you have to do 20 plus minutes of this sort of work to get the benefit.
Yeah. So we try to differ between different exercises, otherwise the horses get bored or tired. But you need at least 10 minutes or more to really have a good effect. But I think it's the same as if you would do a stupid hand walk for nothing. Yeah. So, then I would like to start in the box, and usually the owners are more or less happy. This is something the owners can also do by themselves. And they're often quite happy if they tell them, okay, your horse is in box rest, but you can do something. So you don't have...
Horse yoga.
Yeah.
They
like it actually. Sometimes we have owners who don't want to do it, but then they can bring it to us, and they have some groomers who can do it. Or I do it. I usually establish the exercises with the horses until they recognize or they know how to do it, and I know that they behave, and then the groomers or the staff can continue, and then I establish the new ones. So also in dynamics it's the same. Yeah? So if we establish new exercises in walk, for example, also to open the chest and to exercise a little bit the supporting limbs and the serratus muscle, I usually establish the exercise and then the people continue.
Yeah. Some of your research has been based on, you mentioned the thorax and like the swinging of the thoracic limb. And so talk to us about why you consider that to be so important. You've touched on it with these exercises, but lower neck, pathology, and how the thorax affects the swinging of that limb.
Mm-hmm. It's because a lot of people, in particular the riders and the trainers, they are so focused on the gait quality. That means they would like to see a high flight arc, they would like to see a big range of motion in the limbs, they would like to see long strides. But the problem is, for this you need muscles, which is actually quite logical, but a lot of people miss this function. And then they ask the farriers, so how often do you have it that you have a presentation of young horses, and then they ask the farrier shortly before the presentation, can you put some steer shoes on, because it's improving gait quality. But it works because the young horses can't stabilize it, so they of course have more inertia and they have a higher flight arc. But it's actually just try to mimic something because the muscles are not there, and often they get more unstable. Sometimes they start striking, or it's very short term and they adapt to the shoes, and then you don't see the effect anymore. And my approach is more that you make people aware that gait quality is something coming from a physiological, biomechanically correct movement and function of the whole locomotor system.
Yeah, I think that's absolutely a different approach, because about the shoeing thing, try to shoe the horse to get a particular stride, whereas your approach is, why don't we make the horse capable of doing that stride naturally without needing the shoeing?
Yeah, and I think you can do all exercises with horses without damaging them if you prepare the muscles for it. So even if you as a human start to do a new sport, so if you're not trained for it, you can do it, but you're very likely to damage your body. If you're trained, if your muscles are strong, you can do everything, I would say. And it's the same for horses.
And if you had somebody who was saying that their horse isn't moving properly in the thoracic limb, what sort of neck pathologies are you looking for that may play into that?
We know, and if you know the anatomy at least from the cervical spine, we know that we have, of course, a certain problem in the lower spine because we have very small little vertebrae which are under compression from the chest and the whole weight of the neck if the neck is too high. And also the little intervertebral foramina where you have the spinal nerves running through, they are smaller if you have an elevated neck position. And if you have horses, of course, with slight arthrosis or already some disc generations, what we see to a high percentage on horses actually, then if the rider, for example, elevates the head and the neck, we know that maybe the compression and the smaller intervertebral foramina are responsible that the horse starts with limping or stumbling or making shorter strides or is not as strong anymore. So that's why I usually check also in the demo the range of motion in the neck. I try to feel if we have restrictions there. I try to assess the muscles and the strain in the lower neck. And then I often know, okay, maybe the horse is stumbling not because of a wrong breakover, it's stumbling because the neck is not functional.
Yeah, that's a good point you bring out, because we do a lot of contrast sort of vertebral radiographs, and you put the CT on there as well. And I've been really surprised how many of these horses, when we actually do this CT myelogram, how many of them have degenerative changes in the intervertebral discs that you talked about, but also the foramina, how many bony changes there are. And these horses come with unblockable lamenesses. Yeah. And we actually look at their neck and you see, how is this horse moving? Because there's so much degenerative change in the neck, but there's also the intervertebral foramina are actually compressed and probably abrading the nerve roots. So what can be done about those changes?
I mean, if the changes already started, of course we can't rechange them again, so we can't heal arthrosis and we can't really heal disc generations. But I think it's a little bit the same with the kissing spines or other problems. If the muscles are able to stabilize it, the horse can still perform. Yeah, so for example, people who have, like humans, who have a disc prolapse in the cervical spine, yeah, of course, if they don't train the muscles, if they don't make enough sports or compensation for it, they have misfeelings in their hands, or they have weakness in the hands or pain. And the same in the horses. But if you train them, for example, I have 3 and I'm very, very good. I don't feel anything because I think I have enough muscles to compensate. Mm-hmm. And I think it's the same for the riding horses, just because you find the pathologies. And I think, I don't know if I'm right, but I think there was a study that 65% of horses have arthrosis in their facet joints in the cervical spine, or 60-something percentage cervical disc problems. Mm-hmm. Yeah, and I think most of the horses can perform, at least to a certain degree, quite well if the muscles are okay and can stabilize. So if you see the middle portion of the neck muscles activated and stabilizing, you can imagine that this spine is more or less relieved.
Mm-hmm. Yeah, I think that's...
but one thing is not just in the front limbs, we also have the problems in the hind limbs. Yeah, so all these intermittent, strange lamenesses in the hind limbs where you don't find anything in the distal limb, I think most of them are related to lumbar spine, sacrum, sacroiliac joint problems, and irritation of the, how do you call it in English, ischiaticus nerve.
Oh, yeah. Moving down the horse from the neck to the thoracic cage, what problems do you see there that can be manifest as gait difficulties?
So if you start very from the basis, so from the pole, if you have restrictions in the sideway bend or sideway movement, sideway bending, a lot of horses start to use the second joint of the atlantoaxial joint to make this movement, so they start to rotate. So that's the very first beginning, that all the muscles and the spine is not used in the correct way. So if the rider starts to bend, they rotate in the neck. It's often that they also have problems in bending in the thoracic spine. Yeah, so that's the first thing. If they are really unstable in their muscles to protect the spine, they use other muscles like the rhomboideus muscles or the ventral neck muscles, and they are so contracted that actually the head and the neck can't be used as a balance tool for the horse. So they are in a kind of frame. They're really tight, so of course they can't really make a coordinated, balanced, engaged gait. Yeah, and then of course if you have compression irritations of the nerve, then we have short strides, stumbling, whatever. But then it continues. So if you have a high neck position and you have extension in the lower spine, you have extension also in the back. And then the trunk is sinking between the shoulder blades. So of course then you don't have enough elastic energy storage in the serratus muscles and the shoulder muscles. So we don't have, or the horses don't have enough elastic energy to come to a very nice swing phase, so we don't have the propulsion of the limb and the forward movement. We have a very flat gait, short strides. And then if we have an extension in the back, then we have a strain in latissimus muscle, which is also connecting the forelimbs to the hind limbs. So if we have strain there, then it limits also the protraction of the forelimbs. So again, short strides. Yeah, and then the lumbar spine try to compensate, and it's very stiff, so it's trying to stabilize somehow the missing function of the thorax. So there we have a very limited range of motion, and if the lumbar spine is limited, we don't have pro and retraction in the hind limbs, short strides, toe dragging, turning, whatever. So everything is connected.
Yeah, that's actually a good point. Listening to you talking about that, you're right. The whole horse is connected from the front to the back. I mean, people tend to look at problems in isolation, have a neck problem or have a front limb problem or have a lumbar problem or a hind limb problem. Your philosophy is that everything's connected.
Yes.
And it makes sense in what you're saying, is that if this part isn't working, maybe the other part can't compensate. You touched earlier on like the lumbar vertebral column and the sacrum and the sacroiliac joints. What degenerative changes do you see in the bones there, and how are the muscles called on to compensate for those?
Yeah, so I must say our imaging is very limited if we talk about the pelvis. I mean, you maybe have more options than we have, but so I can't see all the pathologies. They are probably there. What we see from our dissections and specimens in the institute, in the anatomy, we have more horses than we thought with sacroiliac joint arthrosis or hip arthrosis. So more is really shocking how many horses showing severe pathologies in these joints and were not really visible as patients. I think they have the problems, but nobody really diagnoses. And in the lumbar region, we often see this so-called hunter's back, which is really firm, but if you dissect it, you don't see actually bone proliferations or something. It's just soft tissue like fascia and muscles, which are so contracted and so glued together, I don't know, that you have indeed dysfunctions there. So I can't say that I can make always a link between the pathology or the poor gait quality and some diagnosis, but I'm very sure that we miss a lot of diagnosis because we don't see it or people don't check it, and it causes a lot of problem for the horses.
Yeah, you're right. We all struggle with imaging that area. I mean, we try to get some standing pelvic radiographs, or sometimes we even lie the horse down, and we're still so limited by the generator that we just cannot get the fine detail that we need that we can see in other regions. But, as you mentioned, you're dissecting these horses and finding a lot of these changes, which again are really affecting the gait.
Definitely.
Nutritionally, is there anything that you see that can help in this situation? You're talking about training muscles, you're talking about inflammation. Is there anything nutritionally people could do for their horse that could potentially help some of the problems you've talked about?
I must say I'm really not a nutrition expert, so this for the first. So what I, of course, always try is to keep them in shape, which sounds very, very basic, and I'm sorry for this, but it's one of the main problems. So often if they are on box rest, of course they gain weight. Yeah, so this is something I'm looking. I focus a lot if I talk to the owners and to the groomers. They have to keep the horses in shape, and I mean, in general, I think our horses are not underfed. We have a lot of horses who don't miss anything. So usually all the horses get enough nutrition and extra food. So of course, we can always discuss like curcuma and all these how do you call it, intrigants, a little bit anti-inflammatory.
Yes.
So I recommend it, and also CBD and everything. You can always try it, but I don't have a preferred nutrition recipe.
Yeah, right. Yeah. So basically, your approach is exercise and conditioning the muscles to actually balance the horse.
I mean, of course, we have blood samples and we test if they have somewhere a lack of something. So then we sustain it. But it's not that I would say all of my horses get, how I said, anti-inflammatory food to prevent something. It might work. So if the owners come with it and it makes any sense, they can give it. But it's not that we have a special food for our patients.
Yeah, but essentially what you're trying to do in that situation is you're covering up the problem or attempting to manage the problem when you take a more fundamental approach to say, let's condition the horse and let's balance the horse and hopefully we won't have these problems.
Yeah, usually we are quite successful.
Right.
So I have to knock on wood. But usually I had a few cases where they said they are not rideable or they are with a third tendon injury, so they have to quit the career or whatever. And often if you take your time, so of course you need a little bit to train them. Yeah. So of course we need maybe 4 or 5 months, maybe 6 to have them ready. But until now, most of the horses are still in use and still happy with their owners.
Do you ever have a situation where some of these gait deficits you can track back to, say, saddle fit? You're right. And what's your approach to dealing with those issues?
I check it. Yeah, so if the horses are coming and we are starting to riding them, or they should be start to be ridden by our trainers, I have to check the saddle and the equipment in general. So, and the saddle fit is crucial. I can't train a horse without a fitting saddle. And unfortunately, I must say most of the saddles are not fitting. So sometimes it's very difficult because, of course, if the posture of the horse is different, so it's different if I fit a saddle for a really engaged upper line or if I have a saddle on a hyper-extended back, so then we really have to check for which condition was the saddle originally made, but most of the saddles are not fitting. I'm not a saddle maker, but I can definitely check if the saddle is fitting in the most parts for the horse. If not, I recommend to contact the saddle fitter and we are in communication.
Yeah, because we see like behavioural problems come through at the clinic, and the horse doesn't want to be ridden. Well, often it's a lameness, right, or it's some of the things you talked about. But sometimes the saddle does not suit the horse, and people try to put extra blankets on to make the saddle fit the horse because they've spent all this money on the saddle when it is the wrong saddle for that horse, and that's a really difficult conversation to have.
Yeah, then you have the second conversation with the rider. So sometimes the horse is ready, the saddle is fitting, but then you see that the rider is let's say, not very well trained or not symmetrical or not able to help the horse. And I have a very good riding trainer who is doing a lot with correcting people. So she's also working with physiotherapists and whatever. So if I see the people riding on the horse, so usually when we are in the final phase of rehabilitation, they come and they can train the horse with us. And then, of course, we see, maybe the problem is also sitting on the horse, and then we very friendly recommend kind of lesson with our riding teachers. Usually they really like it, and she's a great woman. She's making a good job. And we have also people from the USA coming, so she's working international. So I think she knows what she's doing. And then we train the rider if necessary as well, but because this is also one of the puzzle pieces.
Right, yeah. There's sort of riding the horse and then there's riding the horse, right? Yes, so the person must be positioned correctly. And
it's very funny. Sometimes our trainers manage to keep the horse in a very good posture during riding and doing the exercises. And then the original rider is sitting on the horse, and the horse's memory is really good, and they make, this one, and then they lift up the head again and make the same cruel movement. And I said, oh no, this is not working. We have to teach both parties, rider and horse, how to come to a good posture and training.
Yeah, because we have people bring horses to us, but they bought this horse and they saw somebody riding it, and then they're wondering why the horse is not performing like that for them is because they're not riding the horse in the same way. They just don't have that relationship, or they're not taking the signals of the horse how to get the best out of it.
Yeah, and there we have the fourth part. So I also did a specialization in equine behavior, training and communication. Not an esoteric way, I really mean on a very fundamental research way, because I always have the problem that some horses are not behaving, let's say, normal or like horses, because people treat them in the wrong way, with purpose or without purpose. And then it's very difficult to train them. Often I really have to find a base to the horse where we can communicate, and then I establish the exercises. But then the owner comes and I try to bring them together to work, and then I recognize that the horse is very dominant and is not interacting with the owner at all, or in the wrong way, or it's very shy and the owner is too stressy or whatever. So that's also the fourth part we try to improve.
All right, so you're not only treating the horse, you're treating the person.
As well, yes. I'm a good psychologist.
I think that's, as veterinarians, that's something we always strive for.
Yeah, no, that's a fabulous conversation. You're thinking about some things that most of us never think of. Is there somewhere that our listeners could go to learn more about your work, or specifically about doing exercises with horses that are on stall rest?
Well, there are different, let's say, academies. I know that in Germany we have also one international where you can make trainings. That's International Veterinary Chiropractic Association. They are doing something. But yeah, usually I think keep your eyes open and try to go to other professional educational trainings. So I started to go to human trainings for neurology, for example, to develop the knowledge in this aspect, or go as a farrier to some osteopathy training, or go to some rehab training session for veterinarians, or go with your veterinarian somewhere, because I think there's no comprehensive training about rehabilitation in horses, very few. We have one in north of Germany. They try to make a kind of educational training over 4 modules, where you have most of the things included. It's the ABNR Academy. So they are doing biomechanics, rehabilitation, and training of horses in 4 modules. Okay. They are not too bad. I think they conclude a lot, but I think for the Americans it's a far way. So maybe you should establish something in the US.
Well, it's just, to Bart's point, very interesting conversation, because you're looking at this problem differently. And you're trying to put the whole horse together, whereas as we started off, some people look at the hoofs, some people look at the tendons, some people look at the neck. And you're trying to pull all of this together, which is a unique approach, but you also have a very unique background. And like all of us, there was somebody in your background that wasn't a veterinarian, but actually led you down a path that actually made you the veterinarian that you are. And so we all have somebody like that in our career. Yeah, somebody that sticks out for me is he was actually a sheep and beef farmer, and I learned so much out of handling a hoof and handling a horse out of that guy. And this wasn't what he did, but he was really formative in how I handle horses and keeping myself safe. Right. Yeah,
and I think it's like a puzzle. You face a problem, you learn how to solve it, and then there's a limit, and you would like to go further, and then how can I find information to improve myself? So I think that's the best way to develop.
Yep, that's a great philosophy. We're always learning. Yeah. So thank you for coming on StallSide this week. This has been a fascinating talk.
Yeah, no, appreciate you being here. Thank you very much.
Thanks for having me.
Yeah, and that was StallSide for this week. We've been with Dr. Jenny Hagen, who has a holistic approach to lameness and rehabilitation in horses. See you next time.